Hello and welcome back to Dr. Carri's Clinical Corner. And today I want to talk about pelvic pain because that's a super common thing that I treat in the clinic, and 2 tools that can help you with pelvic pain. And so in the clinic, when people have pelvic pain, a lot of times they have tightness in their pelvic floor muscles. So if that's you, probably don't need to do Kegels. So if you have pelvic pain and we're assuming muscles are tight, we don't need to do Kegels, which are going to make muscles even tighter. But instead, we're going to work on sort of stretching and relaxing those muscles. And if we're talking about vaginas and stretching, I know those words seem incompatible. This doesn't mean your vagina is going to be loose. Okay, that's like a made-up thing. There's like a happy medium. We want everything to be like able to relax and able to contract, but we obviously don't want it too loose, but it should be like able to relax, able to contract. So here's 2 tools that I use. So the first one is called a pelvic wand, and this basically becomes an extension of your hand. It's like a handle, and it's both of these tools are so you can work on the muscles internally yourself. So these are made for vaginas. There are some tools for the rectum if you have rectal tightness, but I don't use those as much. So if this is the pelvis and your pelvic floor, so in the clinic, I'm working on these muscles by hand, usually inside the vagina. These are your pelvic floor muscles. But at home, it's kind of hard to reach that yourself. So this tool becomes an extension of your hand, and then you can work on this yourself. The other tool, these come in a set. You can buy one, but usually we do a set. These are called vaginal dilators. And so this set is made of silicone. They're like firm, but like flexible. So I'll tell you, when I first started working in this field, all the vaginal dilators were hard plastic. So imagine you have pelvic pain, sex hurts, penetration hurts, and the treatment tool is putting something hard plastic in there. So these start as small as this size, which is similar to my finger. Okay, so for people who are really scared of it, it's like you can start with something this small. If you can insert a finger, and for some people, inserting a finger is painful. But that's the smallest size that we can start with. And then we're skipping sizes here, but then they get progressively bigger, and there's even bigger ones than this. So it doesn't go from that to that. That's a big jump. There's some in-between sizes, but I just wanted to show you. So these are more for like a general stretch. So the pelvic wand is for like specific tight points more, and these are more for general stretching. So what we do with these is we insert it vaginally, and then it kind of just hangs out. Obviously, this model is not to scale. Nothing is going all the way to your spine, and the angle is a little bit different. But basically, yeah, it just goes in, it hangs out, and it just sort of gives a general stretch. And again, this is an imperfect model. Right, muscles expand and contract, and this is hard plastic. But yeah, so that's the difference. So dilators for general stretching and expansion, pelvic wand for specific tight points. How do you know which one to use? The best way to know is to go see a pelvic floor therapist. So a lot of my clients will test these 2 in the clinic, or I'll kind of have an idea, say like, I think this is it. But some people, it's like, you could go this way or this way. So maybe we test both. Or maybe people are like, there's no way I'm going to do this, but I would do this. This is like somewhat more passive. So the dilators you basically put in, and then you just leave it for 10, 15, 20 minutes. So a lot of people will tell me they put it in, and then they watch a show, and then they take it out. Where this is like you're actively working the muscles. So partly it depends on if you're going to use them. But also, I usually tell people, I usually recommend dilators if people have generalized tightness, like they can't have penetrative sex. It's really, really difficult to have pelvic exams at the doctor. Like those people probably need this. What it feels like to have more specific point is like there's certain parts of, like, I can have penetrative sex, but there's certain angles or certain positions that hurt or certain areas that hurt with penetration. Or maybe they know they feel pain on one side. Maybe they have a hip pain on one side. So for them, it's like we want the more specific pelvic wand. And so that's the difference. I have some discount codes for you. They are affiliate codes, and I will put these in the description below of the these brands that I like. And yeah, I really like both of these. They're high quality companies, reputable companies, and they're silicone, like pure silicone. So, pure silicone, you can boil it to sterilize it. You can wash it with soap and water. But also I tell people no silicone lubricant. You want a water-based lubricant or oil or aloe. Silicone lubricant will break down the silicone tools or toys. So just an FYI. But there's a whole bunch, well, I haven't seen any other pelvic wands, but there's a whole bunch of different dilators out there, and I'm going to do another video of something really interesting I found with different quality dilators. So look out for that.